Do you like our quote? This is a lovely hate mail I got on the weekend.
Are you in your Oh my goodness.
So dare I use evidence to refute the abortion propaganda.
Oh my goodness. I can't even deal. They always sit on the corner of the University Plaza.
Yeah.
And they're always there.
They're always there.
I just quickly make my way and try to be one of those out there. Okay, awesome.
Probably multiple chairs. I don't want you to tip or anything.
Oh, okay. Okay, so thanks, Lindsay, for taking the time to speak to me today about the Connect app. And this interview is for our digital government course, and some of the topics that we cover there are around digital platforms and some of the user-centric considerations that you take when developing digital platforms. We also talked about open government and providing government services through digital platforms, and sort of how the government can leverage private partners, not-for-profit partners, to do things that maybe the government is not in a place to do, or it's too political, et cetera. So that's why it was really interesting to talk about this app as the culminating project for the term. So can you start a little bit by just talking about the app and sort of how the partnership with Community came about?
Yeah, so Shore Center's been around since 1972, and one of our main areas of programming has been to support people who are facing an unplanned pregnancy, understand their options, and connect to a healthcare provider, whether they're continuing the pregnancy and need a midwife or an OB-GYN, or they'd like to end the pregnancy and connecting with an abortion provider. So we were finding, because of the political nature of abortion, it's very difficult to find referral information for abortion. And it's one of the few, I think probably the only surgery where the patient books the appointment themselves. You don't go through your family doctor to book your abortion, you book your own abortion. And yet, the system has never really adjusted to that right that women have to book their own appointments. And so a lot of the hospitals, at least our local hospital, use a back line to book your appointment, and they use a code word that you have to use to book. And it's really shrouded in secrecy. There's nothing on their website that says they offer abortion. And so when people in our community are looking for abortion care, it's really hard for them to find referral information. So the year before we launched the app, we took 800 calls from the community where the only service we provided was handing out the phone number. They didn't want counseling, they didn't want information about their options, they didn't want to talk about their decision, they just wanted the phone number to book their appointment. As a small charity, that was a huge waste of our resources to be picking up the phone and essentially being an answering service for a publicly funded hospital. So this was a growing frustration that we had, because at that time our reception was staffed by volunteers, and volunteers that could be doing more useful things like counseling or education workshops at schools. There were better things they could be doing with their time than just providing the phone number and the code word to book your appointment. So we looked at doing a Google form or something on our website, but we're primarily social workers and not the most tech savvy. But I knew there must be a solution here in tech where a patient could go through their pregnancy situation, their preferences, and get the right referral. Because every clinic is a bit different, and they all have different criteria. We couldn't just put the phone numbers up on our website, because patients would then just be calling through and being told no over and over again. So we really wanted to personalize it. So we reached out to Communitech, and I had a meeting with them, and I just said, is there any way I could put in your newsletter or something that if any tech people would like to help out a charity, we really need some help here, and we don't think it's that complicated. And they said, well, why don't you join this incubator called Fierce Founders for female-led companies, and learn how to actually properly pitch an idea to a tech company, so that you're not just putting a little blurb in a newsletter, you actually know what you're asking for. So I actually went through their program. It was a 6-day intensive boot camp where people came from Communitech and from other tech incubators and taught us how to pitch properly, how to develop a business plan, how to kind of identify our user and design thinking and lean business planning, like all of the steps. Lots of sticky notes everywhere. And so I was sort of in this hub of, about 12 female CEOs who own tech companies that did all kinds of cool tech stuff. And I was the only charity. But they made a space for me, and I learned a lot. And I was able to pitch at their pitch competition. And then after I had my pitch down, I just went around town pitching to anyone who would take a meeting, trying to see if someone could develop this for us. And so we were able to find a partnership with Zeitspace, which is a local software development software company that really specializes in user experience. So it was an all-male company when they took us on, but they were very considerate and really took the time to get to know our issue. And we did a design sprint together and came up with what the platform would look like. And then over the course of a year, when they would have downtime in between projects or co-op students that needed to practice a certain skill, they would work on our app for free.
Oh, wonderful. Wonderful. And can you take us a little bit through that process of like identifying your main user? And you mentioned that it's an all-male company. So what did they do sort of to mitigate maybe the unintended consequences of having an all-male company?
So I think at Shore Center, one of the things we pride ourselves is we really get to know our clients and we know what their needs are. And so we did a lot of user testing with our own clients, with our volunteers. Many of our volunteers were our clients at some point. And so we were able to sort of test everything out with them, so that we could make sure that it did reflect their needs. We also have a youth advisory committee and they went through the app as well, of 14 to 22-year-olds. And they went through and provided us feedback for the app as well.
Oh, wow. That's amazing. And in terms of as you developed the app launched, is there still some of the things that we talked about in classes, like being agile? When you launch something like a digital platform and making sure that even though you might have thought that it met all the needs of your users, making sure that there, as problems come up with the functionality of the platform, you adjust and make sure that you continue to meet those unmet needs.
So we launched the app, the local version of the app. So it really right now is for Southwestern Ontario clinics. So we do check in with those clinics regularly and update their information. Medical abortion became available as we launched the app as well, and so a lot of clinics have added the pill option to their offering, so we've been able to add that as an option on the app if that's a preference that the patient has. We changed the phrasing of whether or not they wanted, instead of calling it a doctor, we now call it a clinician, just little tweaks here and there based on feedback we received from clinics, from users, our own learning. We're constantly learning as we go through this. And over the last year, we've continued to work with Zeitspace to launch a national version. So we've contacted all the clinics across the country, collected all of their data, and have placed it in the ad. And so we'll be launching the app at the True North Conference in June. So it'll have national coverage, and no matter where someone lives, they'll get Google ads, and they Google abortion in Canada, and they'll get directed to our app. And that way they can just get the phone number to the clinic that best meets their needs, whether they live in the middle of nowhere or in a large urban community.
And is there, in terms of partnership of developing the app, the financial cost, is it something that is tough for a not-for-profit like Shore, or do you depend on, other partners, whether in the private sector or in the government sector, and do you see sort of deficiencies or barriers in that from that end in meeting the goals that you see going forward?
So Zeitspace has donated the app completely. So we own it, and they built it and have donated it. So we have complete control over it. Really, the government should have something very similar to the app on its website. Our local LHIN, or the provincial government, if you look for abortion on their website, you'll find nothing. You might find our phone number, maybe. But there's just government, for whatever reason, the ministries of health do not see it as their role to help patients through this, and none of the patient navigation systems include abortion. It's really often treated like it's not even a medical procedure, like it's something else. entirely, and that's how it's treated by hospitals, that's how it's treated by the healthcare system in general. So really, like, the Ministry of Health should own the app and should be responsible for updating it and managing it. So, you know, to have the onus put on a small charity like ours, I don't think it's fair. Luckily, we did find a great partner in SciSpace, and they do donate it, but we did have to hire someone to go and call all the clinics, update all their information, and we'll have to do that regularly to keep the app up to date.
Wow. And have you talked to government partners in terms of what has been sort of their response?
No.
No.
No. Yeah.
Is it just because it's too political in nature?
I think it's because it's too political, because abortion care is sort of, it's such a disparate system where you have, you know, clinics kind of doing their own thing. Like, we've even asked, like, our local LHIN just to put Grand River Hospital's abortion line on their patient information page.
Yeah. Wow.
Yeah. So even the local hospital, like Grand River, we're just starting to see drafts of what they might put on their website about abortion. And again, it's all couched in, you know, options or termination. Like, to say the A word in 2019 is still seen as very, very controversial, when it should be just part of the range of reproductive health services that are offered to people.
Yeah. And do you think that's why when you did that sort of user-centric design and consulted with and did consultations with users, you found that there was sort of like that negative connotation with any wording around the healthcare system?
Exactly, yeah. And I think for if you look at the app, it's very clean.
Yeah.
It's not flowery. It's not pink. It's not gendered in any way.
Yeah.
Very neutral. We treat it like it's a health issue that you're going through.
Yeah.
We, of course, offer counseling if people would like to connect with us for counseling. But for the majority of people, we find they just want to connect to the clinic.
Yeah.
At the clinic, they'll meet with a counselor before their abortion.
Yeah.
They'll have all their medical questions answered. There's no need for this middleman system where you call a small charity to get a phone number for a health service.
Interesting. And in terms of, from your experience around this issue and, you know, trying to fill in a gap that government is not willing to fill in terms of government services using the digital platform, where do you see sort of that interplay? Like, you know, I don't think we've had a conversation in the public about where government fits in. What's the scope of their role? What's the scope of the role of the not-for-profit? What's the scope of the role of the private sector? And what are we comfortable with each of those players doing? Do you have any views on that, maybe in relation to the app and the issue you're trying to tackle?
I think healthcare providers or agencies that provide healthcare services are like, the onus is on them to provide information about that healthcare service to patients who are paying into Medicare. Like, I just think it's unreal, the secrecy that we have, especially from publicly funded hospitals. Most of the clinics have a full website, they have contact forms, they have online chat, they have, you know, you can call, it's very clear, they have 1-800 numbers. So a lot of the freestanding clinics, like, they recognize that's what the patient wants. Hospitals are just so secretive that they provide abortion, and they don't, like, very rarely will they put anything online confirming that they offer their service, what the patient can expect of the service, day of, how long they're going to be there, how much parking. These are all the things we have on our app. You know, whether children are allowed at the clinic. You know, if they have Saturday appointments, how long their wait times are. These are things that patients expect, and rightfully so. Instead of having to go, like, before we had the app, people would go on a Yahoo Answers thread that someone had posted in, like, 2009 about how they called the code word Bridget at Grand River Hospital and booked their abortion and what it was like when they got there. And that, at the time, was the best available information a patient could find about booking an abortion in Kitchener-Waterloo, which is ridiculous. And then so, because there is a hodgepodge of providers, people assume, well, if I live in Guelph, I can get an abortion in Guelph. You can't. I live in Cambridge, I can get an abortion in Cambridge. You can't. There's, like, it's not at Grand River Hospital, it's at the Freeport site, up by Fairway Mall. Like, nothing is transparent about the system. And in 2019, it doesn't have to be so secretive anymore. Yes, security is always a concern, but you come to our office, we perform abortions here with the pills.
Yeah.
We have no issues.
Yeah.
Yeah.
And has that affected folks that need abortion in emergency cases?
Yeah.
In terms of accessing services?
Well, the thing with abortion is very time sensitive. So if you're getting delayed going to a walk-in clinic, if you're getting delayed going to your family doctor, calling to an anti-choice organization because it says pregnant need help, you have options.
Yeah.
All of those things delay your access to a very time-sensitive procedure, where if you're a week or two off, it completely changes what your options are.
Yeah.
So abortion is sort of an emergency. You do need to get booked in within a week or so.
Yeah.
And the clinics in this area are only open once a week.
Yeah.
So if you don't get in that week, you're waiting until another week, and you may have to travel to Toronto or London. So, being able to have the information at your fingertips, everyone Googles. Like everyone, that's where they go first, before they go anywhere else. But if they Google and they can't find any of the information they're looking for, then they'll go to the walk-in clinic, they'll go to their family doctor, they might go to a pregnancy resource center, and then get all turned around.
Yeah. And why do you think maybe there's not much more of a discussion if all of these things, as you said, are going on in 2019? Why isn't there a lot more of a discussion just from a healthcare perspective, from eliminate sort of the political nature, which is really hard from this issue, but there's not even a discussion at a service level, and I think that's an interesting angle as folks that, like myself, that are trying to go into the public service and sort of, be that professional advice to government, eliminating that political nature. Why is that discussion not even happening?
We're still sending faxes. It's really, I think the whole bureaucracy is just very set in its ways. They talk a lot about patient-centered care, but I don't think they actually ever talk to patients directly. Our own local hospital said they had never received a complaint from a patient, and we've received multiple complaints from patients about the shadowy nature of the clinic, some of which we had helped patients complain directly to the hospital. They're very arrogant, I think, that the way that they do it is the best way.
Yeah.
They're also so concerned about privacy and security to the point that I think they use it as an excuse. Instead of learning how to do security and privacy properly, they just use it as a shield to say, we can't even do email because email is not secure. There's ways around that. And working with experts in the private sector who, we do all of our banking online. There's no reason why we can't do more of our healthcare online as well.
Yeah. No, that's definitely...
People are stuck in their ways, and they're very quick to throw up roadblocks instead of saying, I'm not sure how we would do that, but let me check and see what's possible. There's just this reluctance to even try.
Yeah. How much we talked about sort of like the intersectionality of delivering digital government services and access, and particularly around equity, right? And how some identities are privileged over others, whether in the consultation process or the actual services that the government prioritizes and is transparent about. So, what about that do you think influences sort of the lack of government available services?
Yeah. Well, we know abortion primarily it's women and trans people who access abortion care.
Yeah.
They're often young. They're often of lower income. They don't necessarily have the level of privilege that other people do have. And so even when they do complain, it's never properly addressed. And I think it has a huge, if abortion was any other population group, it would be just treated like other healthcare services. Because it's abortion, it's about, women and trans people having bodily autonomy, being able to make their own decisions about their bodies, and the threat that plays to the structure and to the system, them having that power and control over what happens to their bodies. That's why it's treated with disdain, with contempt. It's ignored. And many hospitals that provide abortion sort of do so almost against their will. You need to have an abortion provider in this radius. This clinic will be the one this hospital will be the one that provides it for the region in the area. But if it's not properly funded, you go into the waiting rooms, they're dingy and gross. The equipment's old. It's sort of separated from the hospital. The staff at the clinic are treated differently than other staff.
Yeah.
And it's because it's women and trans people.
Wow.
Yeah, the sexism, the misogyny, the patriarchy, all of that plays
Yeah.
into this, and especially when it comes to like controlling your sexuality, controlling your body.
Yeah.
You know, the idea that it's your decision,
Yeah.
yours alone,
Yeah.
really it's quite a threat to the
Yeah.
system.
Yeah, and it's also an economic issue for the folks that are trying to access these
Yes,
services.
yeah, like it is many low-income people, often who already have children,
Yeah.
who know how expensive it is to raise a child, and you know how much they struggle as parents and just making the best decision for their family. We see that all the time. Over half of our patients are already parents,
Yeah.
and they just can't have another child.
Yeah, for sure. And in terms of another question I want to ask you is that 70% of folks that access
Abortion care.
abortion care go through the app now, correct?
Mm-hmm.
Is that a number that shocked you even 1 year into it, or?
It was, we thought our goal was 50%,
Okay.
but it just shows you if people's first instinct is to Google
Yeah.
abortion Kitchener, abortion Waterloo, Cambridge, if that's their first instinct when they pee on the stick and they say, I can't do this,
Yeah.
they go on their phone and they Google abortion
Yeah.
before they call anyone else.
Yeah.
And because we have Google Ads, because we've got SEO, all the stuff that we learned through Communitech,
Yeah.
our app will show up first.
Wow.
And so they click that app, they go through the questionnaire about how far along they are in their pregnancy, the type of abortion they want, and then they get their referral that way, and then they can call the clinic directly.
Wow.
So it makes sense.
Yeah.
I didn't realize that many people were going straight to Google, but
Yeah.
if you think of the demographics of abortion, it is primarily people between the ages of 18 and 24
Yeah.
who have an abortion.
Yeah.
And so the first thing when you need to find out anything, take out your phone, and you just see. And so if the first hit is giving you the information you're looking for, you might look up reviews on those clinics,
Yeah.
but you're probably just going to call that clinic, one of those clinics that we recommend.
Yeah. So you would say in terms of that target, it surpassed sort of your
Significantly surpassed sort of what we thought, but
yeah.
But when people were calling our office, it's because they had Googled abortion in Kitchener and they were getting our website,
Mm-hmm.
right? Like,
Yeah.
that's why. So instead of they're getting our website, they're getting the app, which is an online app. They don't have to download it on their phone.
Yeah.
They go through it anonymously.
Yeah.
And so people are able to access the referral that they're looking for right
Yeah.
away. So it makes sense that they're using the app.
Yeah.
But I was a little surprised with just how many, their first thing is just go to Google.
Yeah. Are there since there's that questionnaire aspect, do you sort of get to see sort of the demographic of the user?
Yeah, we have the demographic information. What we have found interesting, and what we've learned the most from is the amount of teenagers and 19, 20, 21-year-olds who use the app 2 in the morning, 3 in the morning, 4 in the morning, 5 in the morning.
Yeah.
I think we're probably alleviating a lot of anxiety and helping people sleep because they're panicking, they're freaking out, they're in total crisis. And before, we'd heard from patients all the time, I couldn't sleep, I went online, and I just started clicking down all the links. And that's going to take you down this rabbit hole of just, if you Google abortion and you just start clicking down, you'll see just the worst anti-abortion propaganda that's out there.
Yeah.
So the fact that they could go online at 3 in the morning, they can't sleep, and they can get exactly what they're looking for. Write down the phone number, go back to bed.
Wow.
Get off the internet.
Yeah.
The internet's the worst place to go for health information,
Yeah.
right now, because there's no government for it.
Yeah, exactly.
It's all propaganda.
Yeah.
So the fact that they can actually go to sleep. Your screen is turned off, I don't know. So,
it should still be going.
yeah.
Yeah, we're still going.
Good.
I think as long as the green light is on, we're
Then
we're good to go. No, that's super interesting, and I think because another thing that we've talked about over the course of the semester is you may be reaching maybe this is an underserved demographic, 18 to 24, and the app is providing access to these folks that may have not had access before the app. Are there any unintended barriers that the app presents in terms of maybe other users that aren't as, technologically minded as maybe the 18 to 24 demographic, et cetera? And I don't know if you have any way of measuring that through the metrics of the app.
I mean, people still call the office and ask for the phone number.
Yeah.
What our volunteers now do is just walk them through the app on the phone.
Mm-hmm.
And so they say, when was the first day of your last period? Have you had an ultrasound done yet?
Yeah.
Would you prefer medical or surgical?
Yeah.
Would you prefer a Saturday appointment? And then it'll pop up for the volunteer, and the volunteer will say, based on that, I have 3 options for you. You could go to Freeport, you could drive over to Brampton, or you could drive into Toronto.
Yeah.
And these are the 3 clinics that we would suggest.
Yeah.
Here are their phone numbers.
Yeah.
So at least it's helpful even for clinic staff across the country who often will take these calls, and they're not the right clinic for that patient for whatever reason.
Yeah.
Instead of them, before we'd have a spreadsheet of everything we'd have to go through, and it wouldn't have all the data. There's restrictions on body weight and body mass index. There's all these weird restrictions around abortion that clinics have, and so for us to have to go through that on the phone is more difficult. Now clinic staff across the country can just use the app and walk patients through it.
Standardized.
It's standardized. It's very clear. You don't have to think, oh, but maybe they hired a new doctor, I don't remember.
Yeah.
It'll all be in the app so that they know, what their hours are, how much parking is, they can bring kids in, all of that information is detailed there. And they could even send links by email to the person who's maybe not super tech savvy.
Awesome. I know you're very busy, so I'll end it with my last question. There's been a lot of success around the app over, I think it's almost been a year, right?
Yeah,
It
launched in November of 2017, so it's been more than a year, almost 2 years.
Mm-hmm.
Yeah.
So what's sort of your vision for the app? I know you mentioned the next steps in terms of nationalizing it, and maybe in a perfect world where this is not such a political football and it is seen as another option of reproductive health services, what would you see government's role being in providing these services and helping the work that SHORE does already?
Health Canada could buy it, or they could license us to manage it for them.
Yeah.
The Ministries of Health could do the same thing. We're going to do it regardless. It's our charitable mission to ensure there's access to all choices. So we're here whether we ever get paid to do it or not.
Yeah.
But it would be great if government recognized the importance of the app in addressing this issue, and either licensing it, sponsoring it, purchasing it, if they want to manage it. We've been really clear, we don't feel like we own the app. The app really belongs to the abortion rights movement, and so we've worked with our partners at the National Abortion Federation and Action Canada, the Abortion Rights Coalition, to really, we're lucky because we live in Waterloo region. We have access to this tech talent, but it doesn't mean that others can't also be part of owning the app.
Sure.
So we would be happy if government decided to step in or provide funding just for maintenance. That would be great.
Yeah.
It really is something that has been very frustrating for me, just the lack of ownership around this healthcare service and government.
Yeah.
There's no strategies, there's no, they don't have any materials, they don't even have literature, no leaflet or stuff. There's been nothing from the government on this issue, and patients are just left in the dark.
Yeah.
Because it's a self-referral, they really have to find a way to navigate the system on their own, and it's not fair. It adds to the stigma and the shame that patients go through because they think they're the only ones who've ever done it.
Yeah.
Because it's literally echoing out into the wilderness. There's no support.
There's no support.
It's in many parts of the country.
Yeah. Awesome. Well, thank you so much for taking the time. Yeah, thank you so much. I really appreciate you talking and taking the time. I learned a ton today. Hopefully Samir learned a ton today. So, thank you so much.
No problem. Great to see you.